Hello and welcome to Healthcare IT Today, where we explore the latest trends and interesting technologies from the world of health IT. Today on the program, we're going to be talking about an area of healthcare that frankly needs more attention, and that is rural and community hospitals. Joining me on the program today is Dr. Mark Pratt, Chief Medical Officer for Paragon at Altera Digital Health. Dr. Pratt, welcome to the program.
Thanks so much.
It is great having you here. I'm really looking forward to having this discussion with you. But before we go deep, maybe if you can just do a quick introduction of your role and Altera Health.
So Altera Health is a division of Harris Healthcare. The assets that we have at Altera Health are 3 different EHRs. We have Paragon, Sunrise, TouchWorks. We've been around for a very long time. Paragon has been around. In fact, we're celebrating our 25th anniversary this year.
Wow, 25 years.
Yeah.
That's like 100 years in healthcare terms.
In healthcare, that's right.
All right. Now, I want to ask you this question because it has been definitely a challenging few years here in healthcare, especially for rural, critical access and community hospitals. And Altera works with a lot of them. What are you seeing in this area of healthcare in terms of trends, in terms of challenges, opportunities?
Well, I think what we see over and over again are people challenged with staffing and the ability to maintain a system on their own. We're also seeing issues with getting paid, just like any other healthcare organization, but especially in the critical access and community space, it's very difficult to run an organization that has so many different requirements. I think one of the things that people forget is that these community hospitals are doing everything a large hospital is doing for their community. And so they're just as complex of organization. But that's what we've been working with community hospitals for those 25 years. So we understand them very well and understand their pain points.
And are they going through anything that's sort of wholly unique to them that you're saying like that the rest of healthcare just doesn't have to deal with?
I think challenges from staffing, their infrastructure, the access to resources, and sometimes they're smaller communities, the ability to recruit clinicians and providers to their area is also very difficult for them. What's attracting those providers to those smaller organizations in those small towns? So they're very focused on that. How do they retain employees?
Now, one of the things that we put forward as an industry that really is supposed to help these kinds of organizations is moving everything to cloud native applications, right? Because supposedly that is going to help them keep costs down. It'll help with the minimizing the amount of IT hires that they have, which we know, as you just said, is a bit of a challenge. Are these the primary benefits of cloud? Are there other benefits of cloud that these types of rural organizations can take advantage of?
Yeah, so I think it's the ability to maintain that infrastructure on their own, but people are losing sleep at night hoping that they're not going to have a cyber attack. And so I think one of the big advantages of using the cloud is like we've deployed Paragon in Microsoft Azure, and so we have the full benefit of the cybersecurity solutions that Microsoft architects, and also the full strength of their cybersecurity team, in addition to our own internal cybersecurity team at Altera. So we're the ones that are staying up all night, making sure that these things don't happen instead of having to do that at the customer site. But it's also the ability to, and we'll talk about this some more probably, but the way we're going to deploy Paragon in the future with our new release is the ability to deliver smaller updates. And so they're not having to expend large teams of people to do a major upgrade anymore. We're able to deliver new features in very small packets. So a lot easier to digest.
Yeah, definitely. More smaller, digestible pieces. Definitely a big help for access hospitals because, you're right. They just can't take in a large-scale change. It's very difficult for them. So you brought it up. I mean, usability, interoperability, those are perennial interests, perennial problems. But over the last few weeks, of course, cybersecurity has raised its head in terms of being a massive priority for people now. What advice do you have for rural and community access hospitals in terms of what questions should they be asking their vendors to ensure that they're managing their risks properly when it comes to cybersecurity?
One of the other things is the benefit of going to the cloud is disaster recovery. And so in addition to the cybersecurity protection, the ability to deploy in Azure also gives us redundancy and the ability to restore almost in just a matter of minutes, a complete disaster recovery mode. And so those things are just not traditionally available in on-premise data centers to be that effective. And so that's really one of the other major advantages of being able to deploy in the cloud that we're taking care of for the client.
So when a client or when a healthcare organization is considering a vendor, what are some of the questions that you would recommend that they should be asking of that vendor?
Who are you partnering with, and why did you choose them, and what benefits do they bring to us? And I think that's one of the reasons we chose the partnership with Microsoft, is that we believe their position is puts us in a very strong position as far as protecting that patient data, protecting against cyber attacks, and the technology that they also allow us to have access to. And that's one of the other things that we're excited about is putting Paragon into the cloud also gives us access to other services like cognitive AI, all of those other pieces that the technology allows us to have access to and deliver more really neat things to our customers.
I think you've just set a new record for me. It took this long for anybody that I've interviewed to talk AI. So congratulations, you're going to win the award. That's good. No, I like it because, of course, AI is the dominant topic. But what you just said is very important. Like you're essentially saying that by moving to the cloud, you're able to leverage the power of that cloud, the power of these very large companies. But you should be asking, what is it that those companies are providing? What infrastructure are they bringing?
And that's what we tell. The buzzword is AI, right? But it's one of the other things is talk to your customer, see what they want to accomplish with AI, and not just as a buzzword. Like, what pain point are we wanting to solve in healthcare with this new technology? And a lot of times over and over we hear, well, eliminate all of these repetitive tasks, like help us with some robotic process automation, doing things that we can offload to technology, let those people do other more important things than these repetitive tasks. And so I think it's really ask the question to your customer, what pain point do you want us to help you solve? And I think that's where we'll really get a lot of leverage around using AI and robotic process automation.
Well, let's talk about that a little bit. Is Altera bringing AI in for their Paragon system? How are you evolving Paragon?
We are. We're doing some experimentation right now. We're doing some work with our customers on a couple of different projects around some automation in the revenue cycle areas, but also in doing some predictive things with surgical preference cards as another example. So really looking at those not only pain points for repetitive tasks, but also where can you help us, do cost savings? How can this technology reduce the cost of doing business in a community hospital?
Gotcha. What are some of the other things, Dr. Pratt, that you're working on in general, just for Paragon and for this particular space at Altera?
Yeah, one of our biggest pushes was to do this the containerized deployment model of Paragon, and so. We broke down all of the pieces of the electronic health record into small containers. And so what it allows us to do is, update a particular one of the applications in literally a matter of minutes, as opposed to having to wait for a major upgrade to be complete. And so if we're able to deliver new features and functions in a rapid time frame, that's just more cost savings for our customer. It's less people that they have to staff for an upgrade. But it's also delivering really neat features to clinicians in a lot timelier manner.
Gotcha. So, as a doctor, as the chief medical officer for Paragon, what technology has gotten you excited that you see at the shows, online? Tell me about that.
I think, and we're doing some work with this as well, is ambient voice. Okay, so. If, as a clinician, you spend literally hours of your day documenting.
Yeah.
And if we solve that problem, that's amazing. So we give clinicians back time in their day. But we also give them time to talk to their patient.
Absolutely.
So I think that's one of the most exciting things I've seen in the last couple of years.
Yeah, you hit the nail on the head there. I mean, every clinician I talk to, every physician I talk to is definitely super excited about ambient. Not only because of the time savings for them, but it just brings them back to that one-on-one conversation. And for the most part, the note is 90% accurate, which is frankly as accurate as most scribes were anyways. So I think they're seeing definitely a big benefit of that.
That's really exciting.
Yeah, that's good. That's a good one. So you've shared a lot of great information with us today, Dr. Pratt. Where can people go to learn more about Altera?
Yeah, so alterahealth.com, and we're also on social media as well. So just search for Altera Digital Health. And thanks so much for your time today.
Yeah, thank you for being on the program.
Absolutely.
It's been a lot of fun. We have to bring you back.
Okay, awesome.
And hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to healthcareitttoday.com where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next episode.